Today we are going to talk about one of the most important concepts related with microbiology, right? That is about the concepts related with the exotoxins and endotoxins. What are exotoxins, what are endotoxins, how do they work, how they produce the disease, right? And what type of bacteria are producing exotoxins and endotoxins. So let's start our very basic discussion. First of all, I will ask a question to Dr. Gavin. What is the difference between exotoxin and endotoxin?
Endotoxin is an endogenous part of a bacteria.
Okay, very good. Dr. Gavin is saying that endotoxins are the integral component of the cell wall of gram-negative bacteria. Endotoxins are the compulsory component of cell wall of gram-negative bacteria. To be more specific, endotoxins are present in the outer membrane of gram-negative bacteria. So we can say that endotoxins are the structural component of gram-negative bacteria, right? So let me draw a gram-negative bacteria. Suppose here that this is inner cytoplasmic membrane in gram-negative bacteria. Here this is peptidoglycan, which makes the cell wall, as we have discussed in previous lectures, right? And of course peptidoglycan is having glycan backbones with peptide cross links, and of course around that there is outer cytoplasmic membrane, which is a unique feature of gram-negative bacteria, right? And as we have discussed last time, that in the outer cytoplasmic membrane there is a very specialized structures called endotoxins or lipopolysaccharides, right? So let me enlarge that structure so that we can develop a better view of endotoxin molecules. I know it's a bit review, but it's worth it. This is the outer membrane. I have enlarged its structure. As you know that membrane is made of phospholipid bilayer. These are phospholipids from inner leaflet, and here are the phospholipid on the outer leaflet of the outer membrane. Now, actually within the outer membrane, here there are special molecules of lipopolysaccharides which are embedded in every gram-negative bacteria. And what is the basic and primary structure of this endotoxin? Number one, you must know that there is a core sugar here. This is a core sugar, and then there are special lipid molecules. These are special lipids molecule, fatty acids, right? And these fatty acids with the, what is this? Core disaccharide. Now, this disaccharide with this fatty acid molecule, together this complex is called lipid A. What is it called? Lipid A. Let's suppose this, and with this, these are the, yes, fatty acids, and together they are called, yes please, lipid. This is disaccharide, right? Lipid A. And remember, out of these fatty acid, one of the fatty acid is always myristic acid. What is that? Myristic acid. This fatty acid, which is myristic acid, is unique to endotoxins. They are not present in human cells or any other animal cell. These myristic acids are specific, you can say fatty acids, which are specially present in the lipid A of the endotoxin, right? So this is lipid A. Now, what really happens that outside the lipid A, right, there are special type of, you can say, polysaccharides. These are special type of What is this? Polysaccharides. Now, these polysaccharides, these are the polysaccharide and this is the lipid A. Together the whole complex is called lipopolysaccharide. What is it called? Yes, whole complex is called lipopolysaccharide. Now these lipopolysaccharides molecules are very abundantly present in the outer membrane of all gram-negative bacteria. Is that right? Now, this lipid A, okay, I will just make it like this so that you really remember this component together is called, yes, lipid A. Now, these fatty acids with this disaccharide unit or core carbohydrate, this is all lipid A. Lipid A is the toxic component of lipopolysaccharide. Lipid A is the component which produces the pathogenesis, which produces the disease. It is the toxic component of lipopolysaccharide, right? But lipid A is not strongly immunogenic. When I say that this component of the molecule is not strongly immunogenic, it means it does not activate the immune system. It means that against this component we cannot activate immune defenses. Against the lipid A, we do not make antibodies. This has a very important clinical implication. The clinical implication is that if someone suffers with the endotoxin, endotoxemia, and he survives, immune system is not going to provide the defense to prevent the next attack, because the toxic component of lipopolysaccharide is lipid A. Lipid A, even though it is very, very pathogenic, it is not immunogenic. Write it down, it's worth it. It's a very pathogenic molecule, lipid A, but not immunogenic. And clinical implication with this is that this lipid A not only produces very serious diseases, problems, as we'll see that lipid A is responsible, lipid A of the endotoxins or lipid A of the polysaccharide is responsible for endotoxic shock. And endotoxic shock is the most common cause of death in intensive care units in United States. Due to septic shock, more than 200,000 people die every year in USA alone, right? And out of septic shock, very common cause of septic shock is gram-negative bacteria producing endotoxins. And when there are a lot of endotoxin, we call it endotoxemia, right? And in the endotoxin, pathogenic component is lipid A. And lipid A is strongly pathogenic but weakly immunogenic. Is that right? Strongly pathogenic but weakly immunogenic. Another point which is worth stressing here, lipid A in all gram-negative bacteria is same. Lipid A in all gram-negative bacteria is same. You talk about the lipid A of the Salmonella or Shigella or Klebsiella or E. coli, all of them are having the same lipid A. It has also clinical implication. It means all gram-negative bacteria, when they damage the tissue by endotoxins, the mechanism is same. When E. coli produces endotoxemia, or Salmonella produces endotoxemia, or Klebsiella produces endotoxemia, or any other gram-negative bacteria produces endotoxemia, the pathogenic mechanism is absolutely same, right? It means that different gram-negative bacteria may produce different pathology due to some virulence factor other than endotoxin. If there are 4 gram-negative bacteria, they are producing different clinical problems. Then it means that they are producing the clinical problems due to some virulent factor which are other than lipid A, because lipid A is the same in all gram-negative bacteria. So the pathology which is produced by lipid A, that will be same, right? But pathologies which are different from gram-negative to other gram-negative bacteria, they must be from some virulence factor other than lipid A. Am I clear? Really claro? Okay. Now, with lipid A, we have a polysaccharide unit here. Now, very interesting thing. This polysaccharide unit is highly immunogenic but not pathogenic. It is the reverse of the lipid A. Is that right? We can make it like this, that lipid A is a dangerous component. Lipid A is a dangerous component and polysaccharide is a not producing any disease to us. We are very happy with polysaccharide. This polysaccharide component of lipopolysaccharide molecule, it is highly what? Immunogenic. It means it can stimulate our immune system and make antibodies against it. So if immune system, look, this is immune head office. If this is stimulating the immune system and immune system is providing antibodies against the polysaccharide component, right? Because polysaccharide component does not produce disease, do you think these antibodies can be protective in some way? No. Polysaccharide component is immunogenic but not pathogenic. So when we make antibodies against this component of lipopolysaccharide, even if antibody bind with this component, disease is still produced because there is other component which is pathogenic. So the point which you have to remember in your career, that lipopolysaccharide have lipid and polysaccharide component. Toxic component is lipid, which is toxigenic but not immunogenic, and polysaccharide component is immunogenic but not toxigenic. Is that right? Now you may be thinking, is there any advantage of making, is there any importance of knowing that against the polysaccharide antibodies are made? Answer is yes. Again, there is a clinical importance related with this concept, that polysaccharides are immunogenic. Number one, polysaccharides present in lipopolysaccharide vary from strain of bacteria to the next strain of bacteria. Let me tell you. Polysaccharide component of the lipopolysaccharide varies from 1 gram-negative bacteria to other gram-negative bacteria, even within one group of gram-negative bacteria, from strain to strain, polysaccharide component is different. Is that right? It means if you have one type of gram-negative bacteria, you will have different type of antipolysaccharide antibodies, and if you have other type of gram-negative bacteria, you will have another type of antipolysaccharide antibodies. You are understanding? Due to this reason, that polysaccharide component of the lipopolysaccharide molecules vary from gram-negative bacteria to bacteria. Due to this reason, we make different antibodies against the lipopolysaccharide molecule derived from different gram-negative bacteria and even different strains. So these antibodies help us to identify which specific strain of gram-negative bacteria is present in a patient. So it is of diagnostic importance. For example, if I am having infection with salmonella. Now salmonella has different polysaccharide and Shigella has different polysaccharide, even though both of them are gram-negative. Now, if in my blood antibodies are directed against salmonella specific polysaccharide, it means salmonella has been visiting me. But if I am having antibodies against the polysaccharide component of Shigella, it means the immune system is reacting against Shigella, right? These antibody group is also called these antigens are also called somatic antigens of bacteria. These are also called O antigens of bacteria. Have you heard of O antigens or somatic antigens, right? Now, I will repeat it rapidly, that what are endotoxins? Endotoxins are Endotoxins are integral component of, structural component of the outer membrane of gram-negative bacteria. Other name for endotoxin is lipopolysaccharide. Why we call them lipopolysaccharide? Because endotoxin molecules are biochemically lipid and polysaccharide. Is that right? In this case, in lipopolysaccharide, lipid A component is same in all gram-negative bacteria. Polysaccharide component is different from strain to strain. Lipid A is the pathogenic component. Polysaccharide is not pathogenic component. Lipid A is non-immunogenic component and polysaccharide component is immunogenic component. Am I clear? And now, because endotoxins are not released or secreted by gram-negative bacteria, they are usually released when gram-negative bacteria are destroyed, when gram-negative bacteria undergo disintegration. You are understanding me? Now it has an extremely important implication to understand it. Sometimes if someone has septicemia due to gram-negative bacteria, for example, there is a patient who has septicemia due to gram-negative organism. First of all, what is septicemia? How do you define septicemia? There are a few terms which are very important to know. What is the difference in bacteremia, septicemia, and toxemia? Okay, toxemia we'll talk later. What is the difference between bacteremia and septicemia? We are going to one of our very bright doctor. Yes, please.
We all have bacteria. Few bacteria run into our systems. So bacteremia is you have it in your system, but you're not. Your immune system is not activated. Septicemia is when you have more bacteria in your system and you have an activated immune system.
I'm not impressed. He is saying that if bacteria are present and immune system is not active, it is bacteremia, and if bacteria are present and immune system is activated, it is septicemia. You have to be more specific, more clear, like a bright doctor.
It's actively reproducing.
Yeah, that is the difference. Listen. First of all, bacteremia occurs daily.
Right.
First thing, bacteremia is a very common thing. Bacteremia means mere simple presence of bacteria in your circulation. You know, even in the morning, if you do toothbrush, some bacteria go to your blood. That is bacteremia, transient bacteremia. As soon as some bacteria jump into your blood when you are doing toothbrush, you damage some capillaries, right? And some bacteria go to your blood. Of course, complement system and other defense mechanisms will immediately catch those bacteria and destroy them. And those bacteria don't produce any disease usually. So we say that is bacteremia. Even when you get a little crack in the skin, there is some bacteremia. Even from GIT, every day there are little bit bacteremia. So bacteremia is simple entrance of bacteria in your circulatory system, where before the bacteria multiply and damage, they are removed by our defenses. So bacteria fail to overwhelm our defenses. Septicemia is a condition when bacteria enter into your blood and they are actively multiplying. Bacteria are using your blood as a blood culture. They have overwhelmed your defenses, right? And they're actively multiplying. That is a condition called septicemia. It's a very big difference. Bacteremia is something which happens every day. And thank God septicemia is something which does not happen every day. It's something rare. Not rare, but still less common, more common in hospitals than very common in ICUs, septicemias, right? Now, listen carefully. If someone is suffering with gram-negative septicemia, it means gram-negative bacteria are multiplying in his blood. Or there are so many gram-negative bacteria in his blood which have overwhelmed his defenses, right? Now, if someone has gram-negative septicemia, heavy gram-negative septicemia, sometimes even you give the most effective antibiotic and you kill all the gram-negative bacteria, still your patient may die. You know why? When you give the antibiotic, we destroy all the gram-negative bacteria in the blood. When gram-negative bacteria are destroyed, their structural component like polysaccharides are released in the blood. Blood develop heavy loads of free endotoxins. Lipopolysaccharides are endotoxins. So endotoxemia may be there. So even if you have killed the bacteria, the endotoxins which are released after the disintegration of bacteria, those endotoxins can activate the macrophages and endothelial cells and produce, I will discuss into detail later in the lecture, that those endotoxins can lead to the death. Is that right? Am I clear?